Section 1. Understanding erectile dysfunction and treatment options. Erectile dysfunction, or ED, is a common condition affecting millions of men. It can cause stress, relationship problems, and impact self-esteem. Finding the right treatment is crucial for restoring sexual confidence and satisfaction. Several options are available, each with pros and cons. Understanding these differences is vital for making an informed choice. This essay compares and contrasts two popular ED treatments, Eroxon and Viagra. We'll delve into their mechanisms of action, effectiveness, onset times, durations, and potential side effects. Our goal is to provide you with the knowledge to discuss your options with your doctor and make the best decision for your needs. Making informed decisions about your health starts with understanding your options. This includes knowing how each treatment works, its potential benefits, and any risks involved. Armed with this knowledge, you can confidently discuss your needs and preferences with your healthcare provider. Remember, managing ED is a personal journey, and what works best for one person may not be suitable for another. This guide aims to equip you with the information necessary to navigate this path and find the most effective solution for you. Section 2. Introducing Eroxon, a topical solution for ED. Eroxon is a topical gel applied directly to the penis to treat erectile dysfunction. Unlike oral medications like Viagra, Eroxon uses a combination of vasoactive agents to achieve its effects. This unique delivery method offers several potential advantages for men seeking an alternative to pills. One of the primary appeals of Eroxon is its non-invasive application. This can be particularly beneficial for individuals who have difficulty swallowing pills or prefer a more localized approach to treatment. Additionally, Eroxon's topical nature suggests the potential for faster absorption and a more targeted effect. Eroxon's mechanism of action centers around its two active ingredients, alprostadil and glycerol trinitrate. These substances work in synergy to promote blood flow to the penis, facilitating an erection. Alprostadil, a synthetic form of a naturally occurring prostaglandin, relaxes smooth muscle tissue in the penile blood vessels, allowing for increased blood flow. Glycerol trinitrate, on the other hand, functions as a nitric oxide donor. Nitric oxide is a potent vasodilator, meaning it widens blood vessels and further enhances blood flow to the penis. This combination of vasodilatory effects makes Eroxon a potentially effective treatment option for men with ED. Section 3. How Eroxon works, mechanism of action. Eroxon's effectiveness hinges on its ability to enhance blood flow to the penis, which is essential for achieving and maintaining an erection. This is accomplished through the synergistic action of its two active ingredients, alprostadil and glycerol trinitrate, which target different aspects of the erectile process. Alprostadil, a key component of Eroxon, mimics the effects of prostaglandin E1, a naturally occurring substance in the body. Prostaglandin E1 plays a crucial role in relaxing the smooth muscle tissue surrounding penile blood vessels. By binding to specific receptors on these muscle cells, alprostadil initiates a cascade of events that lead to muscle relaxation. This relaxation widens the blood vessels, allowing more blood to flow into the penis. Increased blood flow engorges the erectile tissues within the penis, resulting in an erection. Notably, alprostadil's action is localized, primarily affecting the area where it is applied, which minimizes systemic side effects. Glycerol trinitrate, the second active ingredient in Eroxon, complements alprostadil's vasodilatory effects by targeting a different pathway involved in blood flow regulation. It acts as a nitric oxide donor, releasing this potent vasodilator into the surrounding tissues. Nitric oxide further relaxes the smooth muscle walls of penile blood vessels, amplifying the effect of alprostadil. This dual action mechanism, combining alprostadil's direct smooth muscle relaxation with glycerol trinitrate's nitric oxide release, makes Eroxon a potentially effective treatment option for men struggling with ED. Section 4. Eroxon's effectiveness, onset, and duration. What to expect. Eroxon's efficacy in treating erectile dysfunction has been the subject of numerous clinical trials and studies. While individual responses may vary, research suggests that Eroxon can be an effective treatment option for a significant proportion of men with ED. Clinical trials have demonstrated that Eroxon can help men achieve and maintain erections sufficient for sexual intercourse. The onset of action is generally rapid, with many users reporting noticeable effects within 5 to 10 minutes of application. This relatively fast onset is a significant advantage for couples seeking spontaneity in their intimate moments. However, it's important to note that Eroxon's duration of action is relatively short compared to some oral ED medications. The effects of Eroxon typically last for around 30 to 60 minutes, which may necessitate precise timing of application before sexual activity. This factor should be carefully considered when deciding if Eroxon aligns with individual preferences and relationship dynamics. Furthermore, Eroxon's effectiveness may vary depending on the underlying cause and severity of ED. Men with mild to moderate ED tend to experience more favorable outcomes with Eroxon compared to those with severe ED. It's crucial to consult with a healthcare professional to determine if Eroxon is a suitable treatment option based on individual circumstances and medical history. Section 5. Potential side effects of Eroxon. A look at safety. As with any medication, Eroxon may cause side effects, although most are typically mild and localized to the application site. Understanding these potential side effects is crucial for making informed decisions about ED treatment. It's important to note that not everyone who uses Eroxon will experience side effects, and their severity can vary from person to person. One of the most common side effects associated with Eroxon is a burning sensation or tingling at the application site. This is usually mild and tends to subside shortly after application. Other localized side effects may include redness, itching, or slight pain in the penis. These effects are generally transient and rarely necessitate discontinuation of treatment. In rarer cases, Eroxon may cause systemic side effects such as headaches, dizziness, or flushing. These systemic effects are often linked to the vasodilatory properties of the medication and are usually mild and temporary. However, it's essential to seek medical attention if these side effects persist or worsen. It's crucial to be aware of the potential for allergic reactions to Eroxon, although these are extremely rare. Signs of an allergic reaction may include swelling of the face, lips, or tongue, difficulty breathing, or a rash. If you experience any of these symptoms, discontinue use immediately and seek immediate medical attention. Viagra, the brand name for sildenafil citrate, is a revolutionary oral medication that has transformed the treatment of erectile dysfunction, or ED. Since its introduction in the late 1990s, Viagra has become synonymous with ED treatment, offering millions of men a safe and effective way to regain control of their sexual health and improve their quality of life. Unlike topical treatments like Eroxon, Viagra is taken orally, usually with water, approximately 30 to 60 minutes before anticipated sexual activity. This convenient mode of administration makes it a discreet and easily manageable option for many men. Viagra's popularity stems not only from its ease of use, but also from its proven track record of success in clinical trials and real-world settings. Viagra's mechanism of action targets a specific enzyme called phosphodiesterase type 5, or PDE5, which is found in the smooth muscle cells lining the blood vessels of the penis. PDE5 plays a crucial role in regulating blood flow to the penis by breaking down a molecule called cyclic guanosine monophosphate, or CGMP. CGMP is essential for relaxing these smooth muscle cells, allowing for increased blood flow and subsequent erection. Viagra inhibits the action of PDE5, preventing the breakdown of CGMP and thereby promoting its accumulation in the smooth muscle cells of the penis. This leads to prolonged muscle relaxation, enhanced blood flow, and a sustained erection sufficient for sexual activity. Viagra's targeted action on PDE5 makes it an effective treatment option for various underlying causes of ED. Viagra's effectiveness lies in its ability to enhance blood flow to the penis, which is essential for achieving and maintaining an erection. This is accomplished by inhibiting the action of phosphodiesterase type 5, or PDE5, an enzyme that plays a crucial role in regulating blood flow within the penis. PDE5 normally breaks down a molecule called cyclic guanosine monophosphate, or CGMP, which is essential for relaxing the smooth muscle cells lining the penile blood vessels. When CGMP levels are high, these muscle cells relax, allowing for increased blood flow and subsequent erection. Conversely, when CGMP levels are low, blood flow to the penis is reduced, making it difficult to achieve or maintain an erection. Viagra's active ingredient, sildenafil citrate, effectively blocks the action of PDE5, preventing the breakdown of cGMP and allowing it to accumulate in the smooth muscle cells of the penis. This leads to prolonged muscle relaxation, enhanced blood flow, and a sustained erection sufficient for sexual activity. One of the key advantages of Viagra is its relatively long duration of action compared to some other ED treatments. Viagra typically remains effective for approximately 4 hours, providing a wider window of opportunity for sexual activity. This extended duration of action allows for more spontaneity and eliminates the need for precise timing associated with some other ED medications. Viagra, while generally safe and effective, can cause side effects, as with any medication. Most side effects are mild and transient, resolving on their own without intervention. However, it's crucial to be aware of these potential side effects to make informed decisions about your health. Common side effects associated with Viagra include headaches, flushing, indigestion, and nasal congestion. These side effects are often dose-related and tend to be mild and short-lived. Less common side effects may include dizziness, blurred vision, or changes in color perception. While these side effects are generally not serious, it's essential to consult with a healthcare professional if they persist or become bothersome. Viagra can interact with certain medications, particularly nitrates commonly prescribed for heart conditions. The combination of Viagra and nitrates can lead to a dangerous drop in blood pressure. Therefore, it's crucial to inform your doctor about all medications you are taking, including over-the-counter drugs and herbal supplements, before starting Viagra. Additionally, Viagra is not suitable for everyone. Men with certain medical conditions, such as severe heart disease, liver or kidney problems, or a history of stroke, should not take Viagra. It's essential to have a thorough medical evaluation to determine if Viagra is appropriate for you based on your individual health status and medical history. Both Eroxon and Viagra offer effective solutions for managing erectile dysfunction, but they differ significantly in their mechanisms of action, onset times, durations of effect, and potential side effects. Choosing the most suitable treatment depends on individual needs, preferences, and health conditions. Eroxon, a topical gel, provides a localized approach with a rapid onset of action, typically within 5 to 10 minutes. Its effects last for around 30 to 60 minutes, making it suitable for couples seeking spontaneity. However, Eroxon's shorter duration of action may require precise timing and may not be ideal for those who prefer a longer window of opportunity for sexual activity. Viagra, an oral medication, offers a convenient and discreet treatment option with a longer duration of action, typically lasting for approximately 4 hours. This extended duration provides greater flexibility and spontaneity for sexual activity. However, Viagra's onset of action is slower compared to Eroxon, usually taking 30 to 60 minutes to take effect. When deciding between Eroxon and Viagra, it's crucial to consider individual preferences, the severity of ED, and potential side effects. Eroxon's localized action may be preferable for men who experience side effects from oral medications or have conditions that make oral medications unsuitable. Conversely, Viagra's longer duration of action may be more desirable for those seeking extended periods of efficacy and greater spontaneity. Ultimately, the best treatment for ED is a personalized decision made in consultation with a healthcare professional. Discussing your medical history, preferences, and any concerns with your doctor will help determine the safest and most effective option for you.